Hello, Borlase students. So following on from talking to you on Monday during your assembly for Mental Health Awareness Week, I promised that I would prepare a video for you because I managed to answer 4 of your questions, but you asked me about 21 questions, which is great, and they were really good questions, and I wanted to make sure that I tried to answer all your questions. So I'm just going to launch in. I'm going to try and answer the questions, and I'm going to label the questions so that you can fast forward and flip through to the questions that interest you. Okay. So, in your opinion, how do you think lockdown has affected mental health? So, I do think it's had a negative effect for most people. I think clearly it's an incident that is so out of the ordinary and is so kind of unexpected and shocking that it has made some people feel quite traumatized. And when we're feeling traumatized, we are often, our brains often kind of go into kind of threatened mode and kind of feel like we're in danger and start looking out for danger more. And that can make us feel quite anxious, can make us feel quite out of control. So so such an unexpected and kind of shocking and kind of world-changing event can have a big impact on our brains and the way we feel. And so it's really normal and unsurprising if we're feeling less kind of emotionally well, if you like. So, but I do think that we'll start to hopefully come out of that as lockdown eases and the pandemic eases. But for some people that come to our clinic Everlief, it has actually helped them. So for some people, it has eased the pressure on them because they haven't been able to, or felt kind of forced to socialize, go out, do lots of extracurricular things. For some of the time, they haven't had to go to school if they found that difficult. So for some people, it has really eased the pressure for them and helped their mental health. And actually, going forwards, although things are starting to resume, for some people, it might have helped you with self-awareness to make you realize, well, actually, I'm not somebody who has to go out all the time and socialize all the time. I'm better off with just a couple of friends, or spending more time at home. Or so I hope that makes sense. That it's helped some people to get to know themselves better and to work out what works for them. So yeah, to answer the question, I think for some people it has really had a negative impact on mental health, and for others it has had a positive effect, quite surprisingly perhaps. So next question. What mental health condition could cause someone to become a shut-in? Now, I think by shut-in, you mean somebody who is withdrawn, maybe struggles to go out. I hope I've got the right meaning there. But so I guess I would say that there are two things that might contribute, and one is depression and one is anxiety, really. So depression, by definition, one of the key areas of depression, but not always, but nearly always, is withdrawal. That people, if you have depression, you often feel like you just can't get the energy up to go out and do things that you used to be able to do, or to socialize with people, and so you end up withdrawing. And sometimes that can lead to a bit of a vicious cycle, because the more you withdraw from everyday life and don't go out, the less confident you feel about going out, and the less able you feel to do it. So you can end up kind of shrinking in your kind of social life and in what you have the confidence to do. So I would suggest that if that is applying to you, whether in a major way or just a small way, I would suggest just trying to be aware of that and trying to ensure that you don't end up kind of going into a negative cycle. So just trying to get out a little bit, perhaps, maybe get out of your comfort zone just a tiny bit every now and again. Go out with those friends, even though perhaps you don't quite feel like it, just to make sure that your confidence doesn't start to dip too much. Another possible cause of shut-in or not wanting to go out, being withdrawn, is anxiety, particularly social anxiety. If you're somebody who's developed um, uh, anxious thoughts about socializing. You know, what if somebody criticizes me? What if I say something and make a social error? Or you have thoughts that make you feel anxious to do with socializing, then it stands to reason that you would probably avoid socializing a bit and perhaps end up staying at home and being shut in more than you used to, even though that's not really what you want. So if social anxiety is something that applies to you, then again, I would say be aware of it. It's understandable that you would want to just avoid all these horrible feelings and end up and stay home, but just be aware that you don't want to end up losing your confidence completely and losing your kind of skills as well for being able to socialize confidently. But it might be that if those things apply to you, it might be that you might need to get some help from somebody on the outside, somebody who can help you work through that. So the next question, what inspired you to create Everlief? So, well, I've always been interested in psychology, and I have in my family when I was growing up, quite a few members of my family had mental health problems of one kind or another, and I always felt a bit helpless and not knowing how I could help. So I always wanted to understand more, understand about therapies and understand what causes somebody to be mentally unwell. And so that's why I went into psychology. But to answer the question directly, I worked for the NHS, National Health Service, for quite a few years. And actually, the NHS is going through quite a difficult time. And so sometimes it means that people who work there, it's a struggle to help people as much as you'd like to sometimes. So, for example, in some of the mental health services, you can only see people for 6 meetings. You can only meet them for 6 one-hour sessions, and most people need a lot more than that. So in 2012, I decided it was time to leave the NHS and set up by myself. Well, actually, have a nice big team now, but initially it was just me, so that I can see people. You know, if I'm working with somebody, doing therapy with them, if they need to meet 20 times, then we can meet 20 times. And some people I end up seeing for a couple of years or even more if they need that. So that's what inspired me to create Everlief, so that I could be a bit more flexible and really help people in as much depth as they needed it. The next question, do you need to be diagnosed with gender dysphoria to socially or medically transition? And then a related question, do you need a parent's permission to be diagnosed with gender dysphoria or to transition? Now, this is a really complex topic. Now, you may have remembered that when I was talking in your assembly, I talked about the difference between medical doctors, like psychiatrists or general practitioners, GPs, and psychologists, where psychologists are a bit less focused on diagnosis. So we might use the term gender dysphoria, but we wouldn't be kind of preoccupied with a diagnosis. So if you feel like you have gender dysphoria, then we wouldn't say that you need the validation of a diagnosis to have that and to seek support. But it is a bit more complex than that. So what I would say is that there is a brilliant service in London, and there are a couple of services around the country, but probably the nearest one to us is in London. And it's an NHS service, and it's called the Gender Identity Service it's part of a place called the Tavistock and Portman Clinic. And that's where it's like a specialist service that you might get referred to if you were if somebody that you were seeing, so your doctor or your psychologist, felt that you needed a bit more specialist help to kind of work through the ideas about gender dysphoria and whether medically transitioning and socially transitioning is right for you, that actually perhaps you would need this specialist service, because these these people in the service work with people with gender dysphoria all the time, and they really kind of they're experts in their field, so they can really help you and understand you at kind of a greater depth. If it's something that's just quite new to you, you perhaps thinking about your gender and exploring your gender, and you haven't really got to, it's certainly not reached the stage of, yes, I want to transition, either socially or medically, then maybe the starting point will be to have a look at a couple of websites out there, and perhaps some, I think there might be a couple of books that I can recommend. So when I'm going to prepare a resource list for you, and I'll try and link to a couple of websites that might be helpful for you. So, the other thing was, do you need a parent's permission to be diagnosed with gender dysphoria? Not to be diagnosed, probably not. To transition, well, that's a much more complex subject, and to be honest, this isn't my specialist area, so you would probably need a bit of specialist advice about that, and it depends on your age as well. So again, I would say, if to transition, you'd probably need to think about specialist services for that. What's the link or relationship between menstruation and mental health? Now, this, I'm afraid, definitely is not my area of specialism. So what I'm going to do, I'm going to see if I can find any links that will help you. But I'm quite happy to admit that I don't know very much about this area. What I do know is that there is a very strong link between your hormones and your mental health. So if during menstruation, there are huge hormonal changes, and therefore there's every chance that they will have an effect on the way you're feeling emotionally. So I guess the only answer I can give is, I'm sure there is a link, but I'm just not a specialist in that area. So I'll see what I can find on that topic. The next question: are drugs or therapy better for mental health conditions? That's a really interesting one, and I would say that it depends. So if somebody's only just started feeling kind of unwell or not right, and it's quite mild or quite early stages, then it wouldn't be the right thing just to proceed with drugs, to give you antidepressants or other drugs. Really, what most professionals would say is that we would always like to try a therapeutic approach first. And one of the reasons is because, well, there are lots of reasons, but one reason is because there are fewer side effects, because all drugs have side effects, and some are worse than others. And another reason is that medicine can really make a difference to people, but it doesn't tackle the root cause. And it's really important to understand the root cause of feeling anxious or feeling depressed or having OCD or having an eating disorder or whatever it is, because otherwise, if you take away the medicine, the drugs, then you're quite likely to go back into feeling the way you did before. So I'm a bit biased towards a therapeutic approach rather than medicine or drugs, but sometimes the two of them can work really, really well together. So for example, if somebody's feeling really, really very depressed, then they're not going to be benefiting very much from therapy, because they probably won't have the energy to be able to engage with somebody and talk with somebody, because when you're very depressed, you have hardly any energy. So if that person took some antidepressants for a while, that might raise them up just a little bit so that they could then benefit more from therapy. So that would be the two working in tandem. So I hope that answers your question. What are the differences between clinical and forensic psychology? I aspire to be a psychologist in the future, and I would like to know more about these jobs. So, well, I'm a clinical psychologist. So one of the main differences is the training. So clinical psychologists, we do a first degree in psychology, so learning all about generally about psychology, and then we go on we get some experience working in services, so 2 or 3 years experience, and then we go on to do a doctorate in clinical psychology. And in that doctorate, we learn to work with people of all ages and in all different kind of areas with mental distress of one kind or another. So we would work with children, we would work with adults, with people with learning disabilities, or now called intellectual disabilities. We would work with the elderly, and then we might also train in specialist services like a neuro service, like a brain injury service, for example. With forensic psychology, you get your first degree in psychology, but when you go on to do your further training, that's all going to be in forensic psychology, which is people who are in the criminal justice system or potentially at risk of being in the criminal justice system. So it's about understanding their profile and supporting them to move forward. So I guess it's a bit more specialized. Some clinical psychologists do work in prisons or forensic units in hospitals, but forensic psychologists would really only work in those areas. So it depends how specialist you want to be, really. I hope that answers your question. What kind of mental illnesses do you see people with the most and least? So our service, Everlief, is we work with only people who come in as kind of day patients, if you like. We don't have an inpatient unit, and we don't have like a 24-hour helpline either, which so we're only open during the day. So that means that we can't work with people who are really, really unwell. So people who are feeling suicidal, we can't really work with people who are feeling suicidal who have very severe eating disorders, for example. So that means that that's just to give you a flavour of the kind of young people that we do work with. But having said that, we tend to see maybe 70% or 80% of the people who come and see us for help come because they have anxiety of one kind or another. Now, anxiety is a very general term. It could be OCD, obsessive compulsive disorder. It could be general anxiety, can't stop worrying about things, or having panic attacks in all sorts of areas of life. Or it might be anxiety about a specific aspect of life, like anxiety about going to school. But yes, overall, about 70 to 80%, I would say, of people who we help at Everlief have anxiety. Sometimes the anxiety is mixed in with other things like an eating disorder or depression. Are all mental health illnesses classed as bad? Or are there some that are actually better for you? Do all mental health illnesses have symptoms or identifiable things? So those are sort of two questions rolled into one. Well, that's a really interesting question. I wouldn't say that all mental illnesses or mental health conditions are classed as bad, and I feel like the word bad is just not helpful, because I wouldn't necessarily say it's good if you have anxiety or depression or whatever, but I wouldn't necessarily say it's bad. It can have a bad impact on your life. But sometimes when you have something that's classed as a mental health condition, sometimes it's there for a reason. It's kind of your brain or your body trying to protect you, if that makes sense. So, for example, if you have panic attacks, if you get regular panic attacks, as I think I said in the assembly on Monday, that's actually just your body trying to protect you. And it's a normal reaction, but just a normal reaction that's got a bit out of control, if you like. So to have a panic attack is quite normal, but to have lots of panic attacks, it just means that you need a bit of help to get your nervous system back under control. But at the end of the day, it's your body trying to protect you. Do all mental health illnesses have symptoms or identifiable things? Again, that's a really interesting question. I would say probably. I'm not quite sure what you mean by that, but it may be that somebody on the outside wouldn't see that you're distressed. Let's say you have anxiety, really severe anxiety and worries, and they're keeping you up all night and they're making you have panic attacks, and they're severely impacting your life. But somebody on the outside might not even see any of that. So they could be hidden. So they might not be obvious to other people, if you've got something going on, but they would probably be clear to the person who is actually experiencing it. What things can be the initial cause of social anxiety? Wow, that's a brilliant question. There are all sorts of things. So it could be that you've had a trauma socially. You've had something happen to you that has made your brain want to protect you and has said, well, that bad thing happened. You got bullied or you got humiliated. Somebody humiliated you. So let's not do that again. Let's not go to any more parties, or let's not ever stand up in class again, or hang out with that particular group of people. Or so it could be that you've had one traumatic incident and your body, so your brain has really taken that to heart and has decided that it's going to protect you at all costs, and it has made you try and avoid social situations, and therefore you get anxious every time a social situation of that kind comes up. So it could be kind of a trauma response, or it could be a combination of difficult experiences, that have just built up over time. So it could be, ever since you started school, you've had a few things happen, a few incidents of perhaps bullying or being teased or humiliated or hurt. And that over time, your brain has just said, I'm no good at this. It's kind of developed this, you've perhaps developed this belief that might not be true. It might just be because of your experiences. But it's your brain is just trying to protect you. So that might be a cause of social anxiety, just small things that have built up over time. Or some people have social anxiety, and one of the reasons for some people is that interacting socially just isn't a strength of theirs, and it's a skill that they struggle with, and therefore they find it stressful and anxiety provoking. So everyone's brains have strengths and difficulties, and social interaction is no different. For some people it comes really naturally. They just go into a situation, they can cope with any situation, whether it's one person or 30 people, and they can chat and they can do small talk and all this. And but their brain might be weaker in other areas, like maybe planning and organizing their lives, just as an example. Some people might not be strong in social skills and social interaction. It might just not come naturally to them, but they might be brilliant in other areas. Who knows, memory or I don't know, can't think of an example. And so that might be one thing that will be contributing to social anxiety, because it's something that you might look around you and think, well, everyone else seems to be able to do this really naturally, and I have to work really hard, and I'm not as good as others. And so again, your brain's going to protect you and sort of make you sort of want to withdraw a bit, make you feel a bit anxious around it, because the brain is very malleable and very it grows all the time. It's growing and developing all the time. You can work on friendship skills and build them, but you can also learn how to manage it, and that's something that you might need a bit of help with. So I hope that's answered your question. The causes of social anxiety: it could be trauma, it could be smaller things that have built up that have knocked your confidence, and gradually just your brain has decided to protect you, or it could be that socializing doesn't come naturally to you, and it's just harder for you than for other people, but that doesn't have to always be that way. What to do to help somebody who's struggling with depression? One thing I would say is Never tell them that they shouldn't be feeling the way that they're feeling. That's probably really obvious, but never try and tell them how they should be feeling. And always just try to empathize with the emotion that they're feeling. So even though you might not feel depressed, if you if they're saying to you, I feel completely empty or I feel completely useless, you can probably identify with that feeling because there may be times in your life where you felt that feeling. So try and think about the actual feelings and think of a time in your life when you have felt like that, even if it was just for a moment. And that will help you to kind of get yourself aligned with how that person might be feeling. And really, I guess that person might kind of withdraw and not be giving as much to the friendship or to the relationship as you'd expect or you'd hope. And so I suppose one thing I would say is just to try and um, accept that somebody who's depressed might feel a little bit one way sometimes in a friendship. And so and once they're feeling better, they will be able to give back a lot more. But when you're feeling depressed, it's really hard to kind of look outwards and kind of be reciprocal, be two-way. So I guess I would say don't give up on that person. How do I ensure to be happier at school, even at lessons I don't like? I sort of touched on this in the assembly on Monday and touched on how sometimes we can feel a little bit. It sometimes goes along with depression, but a little bit empty or a little bit like life is kind of meaningless in some ways. And one thing I would say is that um, I'm going to share these values cards with you that I mentioned on Monday. So, one of the types of therapy that we do, that psychologists do, involves helping people to find meaning in their lives again. And if you're feeling really bored or empty or things are meaningless, then often it's because you've kind of lost sight of what you want from life and you've lost sight of what's important to you. So these values cards that I showed you in the assembly, they help you to kind of regain who you are, what's important to you. Is it creativity? Is it helping others? Is it achieving? Is it really high achieving in my life? And what I would say is, if you're bored in lessons, it may be that you need to discover what your values are, what's important to you, and then that will help you to find meaning in school and in lessons, even lessons that you wouldn't choose to be in. So, for example, if what's important to you, if one of your important values is to help others, and you want to become a doctor or a nurse, but you hate biology, then it will help you to find meaning in biology, that you know that to help others, you need to be able to have passed biology and to have kind of understood the basics of biology. So that's a bit of a simplistic answer, but really, if not liking lessons or not feeling happy at school, one of the reasons might be a kind of not being sure about your values and what's important to you. So it's important to kind of reflect on that. And there might be all sorts of reasons, and I don't want to simplify it too much, but I hope that's been helpful to you. What really is depression, and how do you know if you have it? There are a number of features of depression, and again, just to emphasize that psychologists don't really put people in boxes. We don't go, oh, well, she's got depression, so that's what we need to do. We're more interested in somebody's story and why they might be feeling a bit low or why they might be feeling depressed. So we wouldn't say, yep, here's depression and everybody on this side hasn't got depression. We might say, oh, there's a spectrum here, and somebody's got low mood and they're sort of a bit depressed, but on this end they're very depressed. So it's not a really simple, you've either got depression or you haven't. I hope that makes sense. But if you've been feeling persistently low in mood for a couple of months, and you've struggled to kind of find meaning in your life, and you found yourself perhaps withdrawing from life a bit, perhaps from social life or from maybe looking after yourself, perhaps not taking as much pride in your appearance as you used to, that kind of thing, then these might be signs that you are feeling depressed, or that you might be depressed and that you might need a bit of help. What should you do if you feel as if a GP has ignored or dismissed your symptoms? Can you go alone to the GP and or not have your parents in the room while you're talking? So, absolutely, you can go to the GP. It depends on your age, actually, as to whether you can go alone, but you can certainly ask not to have your parents in the room. And a GP will not need to tell your parents everything that you said. They will need to tell their parents if they feel that you're at risk. If you feel as though a GP has ignored or dismissed your symptoms, then it's really important that you don't give up. And I would suggest trying to get to see a different GP, perhaps. So some GPs are absolutely brilliant and have a full understanding and understand how to ask you the right questions and how to listen to you and where to send you for help. And other GPs don't really understand it fully. So I would suggest trying a different GP and not giving up. If you think you're showing signs of mental illness or abnormality and don't want to talk about it to your parents, where should you go? First of all, I would say do think about that carefully, because sometimes the fear of talking to your parents is bigger than the reality. Sometimes you think they won't understand, or you think you're going to worry them massively and you don't want to worry them, or you don't want to let them down. And actually, sometimes it's not like that at all. And sometimes they would so much rather you told them. And sometimes their reaction is going to be really positive and supportive. So do think about it carefully. I do know that's not the case. Obviously, that's not the case for everybody, but don't just assume that that you can't talk to your parents and then it won't go well. Just have a think about that. But if you're really sure that you can't talk to your parents, then do try to tell somebody. Ideally, you would tell another adult who you trust. So that might be somebody at school. And I know that at Borlase, you've got lots of members of staff who know a lot about mental health and who know how they can help you or where to send you to get some help. So do try and tell another adult if you can, who find somebody who you trust and you think might understand, and then hopefully they'll be able to help you figure out what to do from there. It's been a pleasure talking to you, and as I said, I'm going to put a list of resources together, and I hope you found this helpful. I think I've managed to answer all questions. Some of the questions I combined into one. So if you haven't had your question answered directly, it's probably because I combined it, and I hope that I managed to answer it within a kind of a theme. All right, take care. Bye.